Paula, I'm sitting here, but you can sit where my bag is.
Is that
Thank you.
the bear?
Yeah, and you can just throw my bag.
Yeah.
It is 9:30, so we'd like to get started. Thank you all for being here. So I'd like to call the meeting of the Human Services Committee to order. Karen, please call the roll.
Chair Swarzy,
Here.
Member Childress,
Yeah.
Member Garcia. Here. Member Desart,
Here.
Member Galassi.
Here.
Member LaPlante.
Here.
Great, thank you very much. I'd like to make a comment. I mentioned this in our county board meeting last week, but tomorrow, in cooperation with the DuPage Foundation, we will be announcing the opening of the DuPage Community Transformational Partnership Grants. Round 4 will be the grants for transformational intervention in the areas of food insecurity, housing instability, mental health, and substance use disorders. So tomorrow, the foundation will make an announcement, and I believe we have a press release from the county, which is, I think it's dated for the day after tomorrow. So you'll start seeing that out. Please feel free to share those on your social media, emails, whatever it may be. And please share with the members of your district the fact that this press release will be coming out tomorrow and Wednesday. So I'm sorry, Wednesday and Thursday. Do we have any comments or questions from our committee members? Yes.
I appreciated, Member Krajewski's comments that a lot of the same organizations are getting funding year after year, and I would love to see kind of a broader reach.
Sure. You know, and as would I, and I think all of our members here would, I will say, with the qualifications needed to apply for this grant, there's only so many large entities that are even available to apply, number one. And then number two, there's only so many applications that come in, and Paul and we were on round 3 of the selection committee, but we weren't on round 1 or 2. But I know in round 3, I can't remember the exact number of applications, but there was only a handful of applicants who didn't get something. Almost all of them that applied got something. So the goal is to get more applications.
I know Reclaim 13 has applied year after year and has been denied, so there's one organization that I would love to see support on.
Okay, we'll keep that in mind. Thank you. Yes.
So does that mean that we need to go out and really, and go to other, I don't know, market it to other entities widely and broadly?
You know, I would suggest, yes, if you know there's entities out there that are eligible, and they may or may not be aware of it, I would certainly let them know about it. And if they have any questions,
I don't mean personally, I mean,
yeah, right.
where's Joan?
So I'll just say that, you know, through Giving DuPage, we have a email blast and through our 211 email blast, we reach out to probably, I don't know the exact number, I'm gonna say somewhere between 300 and 500 nonprofit organizations. I know the DuPage Foundation notifies their entire database, which is hundreds of nonprofits. So I think, but certainly if there's organizations that you're personally familiar with, absolutely reach out to them. So, you know, you can always do a better job of marketing, but I think we have a really broad spectrum. And then we send it out through our Homeless Continuum of Care. Other organizations like the Community Memorial Foundation sends information out to their grantees. But to Member Torzi's point, it has to be a larger agency, and they have to be working in one of the 4 areas. And so,
Thank you, Mary.
Thank you.
Yeah,
Go ahead. No, you go ahead and finish and then.
Is there a way to get feedback? Like I know I've spoken to Cassandra from Reclaim, and she said they don't know exactly why they're not getting granted funds.
Yes.
yeah, absolutely. They should call Barb Shapaniak.
Okay.
She's the Chief Program Officer for DuPage Foundation. They offer feedback to any applicant who
Okay,
doesn't
thank you.
receive funds.
That'll be helpful.
And when we have our when Paul and I attend our first meeting at the foundation, we'll make sure we share some of your concerns to
Okay,
make
thank you.
sure it's not just her and I, but everybody that is on that selection committee understands the concerns that the board has. So we'll absolutely pass on those,
Okay, thank
because those are our concerns too, for sure,
Yeah.
for sure.
I was just gonna add, absolutely, I agree with Chair Swarzy. You know, we've always liked to see more people get the money and spread it out. Sometimes the applications come in and they are not specific on what they're going to be using the money. So make very specific on what you're gonna be using the money, because if it isn't on a specific ask, it's very hard to give the money. So
Okay.
that's one thing that their grant applications need to be doing, so.
Mr. Chair,
Yeah, go ahead, Member Guston.
quick question. Do we get a list of, those, applicants that actually did submit? I know you said there's like 500 that it goes out to. Obviously, all 500 aren't going to respond. But at least having a list of those that are responding, then we can identify in our districts, you know,
Sure.
hey, these are the individuals or these are the organizations that have submitted, and kind of keep on top of it.
I can share those with. members.
Perfect. Thank you.
I'm sort of,
I
I'm
think
asking.
We have a contract with the DuPage Foundation for them to run this program.
Right.
And so I think that would be a conversation. Certainly, the two county board members who sit on the committee get a full list of all the applicants. I'm inclined to say, yes, you can share that. But I think we should, it is their program. We contract with them. It's a partnership, but they are, you know, they are actually operating it. So I'm inclined to say, yes, we can share that. But I think we should just talk to the DuPage Foundation.
We'll talk to them.
For sure.
You and I can absolutely talk later about this, Member Guston, but I'll sort of follow Mary's advice on that, but you won't be left in the dark. I will leave it at that.
Can I just say
Yeah,
one more?
Because because if they FOIA it, obviously you're getting information, right? So somebody would FOIA it and they'd get it anyway.
Sure. sure.
But I'm just trying to, you know, be kind of helpful and transparent to those, you know, board members that kind of want to know what's going on in their neighborhoods. Thank you.
Very good.
If I could just add one more thing. The philosophy here, the approach that we've used on this program is not to set a, you know, sort of an eligibility level and then everybody gets funded. It's to fund applications based on the quality of the application. What are their anticipated outcomes? How, you know, what's their logic model? What's their experience? What areas are they serving? So it's not a, so back in the days of the Human Services Grant Fund, we used to have maybe 70 agencies apply. And it was the philosophy of the board at that time that everyone who was eligible got something. And so we ended up with lots of agencies that got about $2,000. And the point of the transformational partnership is to fund programs that are high impact. And so I'm not disagreeing that we'd love to see that's the idea. And sometimes it's not that it's the same agent, it might be the same agency, but it's an entirely new program. It's a new approach. And so that's the idea. It's supposed to be expanding services, doing something innovative. And so even if it's the same agency, it doesn't mean in fact, they're not doing the same thing that they've always done. They have to be doing something. One of the things with the transformational grants is that we have a lot of discussion on the grants committee is this really transformational? Or is this just them asking, not just, I don't mean to say it that way, but that's what the immediate grants are for. The immediate grants are for help us do what we're doing right now and get immediate supports out to the folks that we serve. The transformational is we want to try something different. We want to expand our services or we want to change our model. And so it may be the same agencies, but it's not the same programs.
Thank you for that clarification. Thank you. Thank you. And I will just remind everyone that this round 4 grant is the transformational. It's the longer term. What can we do in the longer term to make a bigger dent in the future for these issues that we're facing? So good questions. Thank you all. And thank you very much, Mary. Okay, I'll take a motion to approve the minutes, item 240372 from the Human Services Committee regular meeting of December 5th, 2023. Got one? Did we get a second?
Second.
Okay, any questions or comments? All in favor, say aye.
Aye.
Opposed? Thank you. I'll take a motion to approve item HSR 424, authorizing execution of the intergovernmental agreement between Pace Suburban Bus in DuPage County Community Services for the Senior Transportation Grant Program, in the amount of $126,500.
Second.
We have a motion and a second. Questions or comments? All in favor, say aye.
Aye.
Opposed? Thank you. Take a motion to approve item HSP 1124, awarding resolution issued to Teen Parent Connection to provide car seats, booster seats, diapers,
So moved.
formula, wipes, and car seat safety training to low-income residents of DuPage County for the period of January 1st, 2024 through December 31st, 2024, for a community services block grant, sub-grantee total of $40,000. We have a motion and a second. Questions or comments? All in favor, say aye.
Aye.
Opposed? Thank you. Take a motion to approve item HSP 1224, awarding resolution issued to Catholic Charities to provide shelter, case management, and financial assistance to situationally homeless residents and at risk of homelessness residents of DuPage County for the period January 1st, 2024 through December 31st, 2024. The Community Services Block Grant Sub-Grantee Agreement also provides financial support for the back-to-school fair for a contract total of $65,000.
So moved.
Second.
We have a motion and a second. Questions or comments? All in favor, say aye.
Aye.
Opposed? Thank you. I'll take a motion to approve item HSR 524, the 2024 Annual Action Plan, DuPage County Consortium, first reading, acceptance of the 2024 Annual Action Plan element, the public comment period of the 2020 through 2024 Consolidated Plan for Community Development, Block Grant, Home Investment Partnership, and Emergency Solutions Grant Programs to qualify and receive the Department of Housing and Urban Development grant funds.
So moved.
Second.
Any questions or comments? All in favor, say aye.
Aye.
Opposed? Thank you. I'll take a motion to approve item HSR 624, recommendation for the approval of the third modification to a Home Investment Partnership Act agreement with the DuPage Habitat for Humanity, Inc., project number HM0903, clarifying the recapture requirements as well as home affordability period for home ownership assistance.
So moved.
Second.
Any questions or comments? All in favor, say aye.
Aye.
Opposed? Thank you. Take a motion to approve item HSR 724, recommendation for the approval of a Home Investment Partnerships Act funds agreement with DuPage Pads, project number HM2102B, the tenant-based rental assistance in the amount of $100,000 under fiscal year 2021, with an additional $100,000 in fiscal year 2024 funds, contingent upon approval by the DuPage County Board and the Department of Housing and Urban Development of the 2024 action plan element of the 2020 to 2024 consolidated plan, as well as receipt of the fiscal year 2024 home allocation.
Second.
Okay, we have a motion and a second. Questions or comments? All in favor, say aye.
Aye.
Opposed? Thank you. I'll take a motion to approve item HSR 824, recommendation for the approval to subordinate two community development block grant liens with Serenity House Foundation, now known as Advanced Resource Recovery Corporation, project CD 1907 and CD 2207 to St. Charles Bank and Trust Company.
Second.
Okay, any questions or comments? All in favor, say aye.
Aye.
Opposed? Thank you. I'll take a motion to approve item 240373, a budget transfer to transfer funds for overtime incurred and paid for with federal funding of the Aging Case Coordination Unit Seniors Grant, which was not originally budgeted for in fiscal year 23, from the account 5,016.60 50,000 to 5,016.60 50,010 in the amount of $1,180.
So moved.
Second.
Any questions or comments? All in favor, say aye.
Aye.
Opposed? Thank you. Take a motion to approve item 240374, a budget transfer to transfer funds to cover employee benefit payments in the LIHEAP program that exceeded original budget during the year fiscal year 23 in the amount of $1,000 from account 50,014.20 50,000 to 5,014.20 51,000.
So moved.
Second.
Any questions or comments? All in favor, say aye.
Aye.
Opposed? Thank you. Take a motion to approve item 240375, a budget transfer to move overtime funds from account 50,435 50,010 to regular salaries budget of 50,014.35 50,000 for the LIHWAP grant program, as overtime was worked less than anticipated for fiscal year 23 in the amount of $3,000.
So moved.
Second.
Any questions or comments? All in favor, say aye.
Aye.
Opposed? Thank you. Take a motion to approve item 240376, a budget transfer to transfer funds for benefits payout from the U.S. Treasury Emergency Rent Assistance Fund from the unused overtime budget to benefit payments in account 5,017, 51,000, not budgeted for fiscal year 23 in the amount of $1,320.
So moved.
Second.
Okay, questions or comments? All in favor, say aye.
Aye.
Opposed? Thank you. I'll take a motion to approve item 240377, a travel request for Community Services Director to attend the NACCED
So
CDBG
moved.
Hill Briefing and Legislative Conference and the NACO Legislative Conference in Washington, D.C. from February 7th, 2024 through February 13th, 2024. Expenses to include registration, transportation, lodging, miscellaneous expenses, and per diems for the approximate total amount of $3,638.50. Questions or comments? All in favor, say aye.
Aye.
Opposed? Thank you. I'll take a motion to approve consent item 240378, change order to close PO 59570001 serve issued to the DuPage Federation on Human Services Reform in the amount of $23,427.74. The contract expired on October 10th, 2023.
Second.
Okay, questions or comments? All in favor, say aye.
Aye.
Opposed? Thank you. I will take a motion to combine items 11A, 11B, 11C, and 11D.
So moved.
Second.
Any questions or comments? All in favor, say aye.
Aye.
Opposed? Thank you. I'll take a motion to approve and place on file item 240379, GPN 001, 24 Community Services Block Grant, Plan Year 24, Illinois Department of Commerce and Economic Opportunity, the U.S. Department of Health and Human Services, in the amount of $1,196,614. Item 240380, GPN 00324 Community Development Block Grant, Plan Year 24 for the U.S. Department of Housing and Urban Development in the amount of $3,663,480. Item 240381, GPN 00424 Home Investment Partnership Program Fiscal Year 24 for the U.S. Department of Housing and Urban Development in the amount of $1,860,190. And item 240382, GPN 00524
Second.
Emergency Solutions Grant Fiscal Year 24, the U.S. Department of Housing and Urban Development in the amount of $288,247. Okay, questions or comments? All in favor, say aye.
Aye.
Opposed? Okay, thank you very much, everybody. On to residency waivers. Janelle, are you online?
Janelle's not on.
Oh, okay, sorry, Anita.
No, that's all right. So we currently have 14 male and 21 female beds available at the center. 6 of those beds have already been offered to DuPage County residents. So, and there are no DuPage County residents that are going to be displaced by this applicant that's seeking waiver. So basically, it's a 71-year-old female. They have never lived in DuPage County, but their only son lives in DuPage County and actually works for the Park District, I believe, and has lived in Wheaton for the last 17 years. There are health issues that make it difficult for him to travel to visit his mom. So they're seeking admission here, and she's also needing 24-hour nursing care right there. So she's currently on our post-acute care unit, received services there, was very happy with the care there, and so is seeking admission here at our facility.
So I'd like to make a motion to allow this 71-year-old woman to
Second.
move to the care center.
We have a motion, a second. Any other questions for Anita? Okay, all in favor, say aye.
Aye.
Opposed? Thank you very much.
The second one was withdrawn.
Oh, I was gonna say,
Yes,
too.
yes.
Okay.
Yeah. Sorry.
Are you giving our care center update as well, or?
Yeah,
Okay.
that's true.
Thank you.
So good news, we have no units on isolation. So that is good for us and for all our residents. We are still following masking protocols. I think that has really been helpful for us long-term. We also monitor hospital readmissions related to COVID because that determines what protocol we will go into. And right now in DuPage County, it's at a medium. So it was, but the surrounding counties are going lower. So I'm hoping in the next 2 weeks, it'll be low. But either way, we do what's needed and we do extra in order to make sure that we follow infection control protocols. Construction, very, very exciting. Floors have all been laid. They look beautiful. Painting has been done in resident rooms. The bathroom tiling is unbelievably awesome. Cabinets are being installed. Again, individual rooms are being painted. The front lobbies, they have actually installed the nursing station cabinets. So it looks really nice. So if any of you want to come take a tour, please call us. So we're really excited. And we're thinking mid-March for that 1-4 North To open up, please keep in mind that tentative, we have to have approval from IDPH to occupy that, but it's looking really, really nice. And one last thing, next month, we're gonna have the Valentine Balloon fundraiser, so there will be more information coming on that. And as always, we look
Always
forward to
fun.
your support.
It's a fun event.
Any questions for? Thank
I
you.
guess I
Oh,
do.
Yes, yes, yes.
I just wanted to ask back to the COVID protocol. I know that all of the hospitals in the area have to, when you go into any medical facility,
Mhm.
actually, you have to wear a mask. It's just a statewide protocol right now.
Mhm.
Is that true for the care center as
Yes.
well? So you're taking guidance from the state, not?
We have to
necessarily
take guidance from the state, and we can go above the state guidance too. So even if the state guidance says, no, at this time, you know, you don't need to mask, I feel like we have taken a more conservative approach. At the very minimum, most of the time, we're asking for a surgical mask. I remember a very short period of time where we went maskless, but we figured the masking is helping.
Mhm.
Well, as a board member on this committee, I appreciate everything
Yes.
you're doing because there's nobody in,
Yes,
And COVID protocols.
yeah, something to knock on, but yes,
thank
so
you.
we're doing well there. Thank you.
Okay. On to community services update with Mary Keating.
Okay, one quick thing from me, and then I'm gonna turn it over to Tori. So, we're putting together our annual report for 2023, but there is one stat that I got last week that I thought was really impressive. In 2023, our outreach team was at 129 different events. That's almost 3 a week, and reached over 6,000 people. So, and part of that is, through ARPA funding. We've got a specific, position that's reaching out into communities of need. And so I was really, really excited about how successful they've been in getting out into the community. And then the other thing is, so you'll remember that, hopefully you'll remember in the 2024 budget, we talked about increasing security over at Family Center. Corey and I were talking, Corey Pappas is the administrator of the Family Center. We were chatting, I don't know, last week or 2 weeks ago, and she was just giving me some really positive feedback on that. So I said, well, why don't you come and tell the committee about it? So. turn it
Good
over
to
you.
see all of you. Happy New Year, I guess. Yeah, so I just wanted to first thank you all for approving the head count at the Family Center. You know, we've always had security nights and weekends, but I talked to a lot of you about our concern with the daytime. You know, we're mediating with families, they're very high conflict, and we never had security. So we've had a daytime security guard for a little over a month, and it has been amazing. I told Mary, I wasn't even sure, you know, you ask for something for a long time and you don't know, is it really gonna have the effect that you hope that it will? And it really has. So just some examples, my office, for those of you who know, like I'm right next to the conference room, and a lot of mediations happen there. And I was security for a long time. I would hear things, I go, I look, I think, you know, do I need to step in? Do we need to call across to 421? Well, now I don't even, not that I don't have to do that, but our security is just, he's that perfect balance, you know, of being present, but not too involved. And he has absolutely helped just keep things at a minimum in terms of conflict. And he's had to step in too. Like we've had certain situations where it got really volatile. We ended the session and someone needs to be walked out, and we can do that like right away. It's not up to my staff to make sure, you know, that everything's
Yeah.
going okay, which that's really not what they're trained to do. I mean, they definitely de-escalate, right? But they're not, you know, trained to absolutely like intervene when it gets that crazy. We also had some shuttle mediations, which is where parents are in the right? Maybe there's an order of protection, something like that. And our security has just been able to kind of be in the space between where the parents are. So again, there's no concern about if someone tries to go up and go to the bathroom. We've had that happen and they see the other parent and there's a conflict. So I just wanted to thank you all for that support and just to let you know it's really, really helped. My staff has come and said, we just feel so much more comfortable being at work, which is what you want, you know? And so, yeah, I don't know.
I just wanted to say, I'm so glad to hear this because I cannot imagine the stress that this has put on you and your staff, because that just not feeling safe in a work environment is not okay. And so I'm so glad that this is come to
No, thank
fruition.
you.
And that
Yeah,
you-
and you know, we're
feel
also
safe.
mediating in the classroom, which is great because of COVID, right? We've spread out in our facility, but then that begs the question, like we're spread out, right? You can't hear everything. So again, people feel safer and it's such a gift. So I wanted to give you that positive feedback. I don't know if you get a lot of that. And then the other, no, well, no, I can come give you guys that, whatever you need. And then the other exciting thing I was just sharing with Mary before our meeting is where there's a couple of judges that are in juvenile court, which we've never really gotten referrals from them. And they reached out to me last week and they want to use our services to help with perhaps like a foster parent, biological parent dynamic where they need a neutral site, whether to exchange the kids, whether to get some information through reports and stuff like that. So I'm really excited about, it's not a new program, it's just another, Mary put it perfectly, another referral source. And I think that will just better serve the courts. It's kind of a untapped resource that we can help them. So I'll keep you all updated once it gets going and let you know numbers and things like that, but I'm really excited. So just another way we're serving more, like children in DuPage County, so.
I'm just so glad we're able to help, by making the decision for the security,
Yeah.
but thank you for letting us know that this was a need, and so that we were able to provide that, but I'm so grateful that, as Member Galassi said, that you guys feel so much safer there and you're able to do your job, which is what you're there to do, instead of just thinking, what ifs,
Exactly. I mean, it's hard work. It's to know what we're getting into, but to not have that extra worry about, is someone acting not right? Do they have
Correct.
something in their, I don't know. It does help. It's
I
extra
can focus
layer.
on the family.
Exactly.
Exactly.
So
So, perfect.
thank you all very much.
Thank you very much. All right. Do we have any old business? Seeing none, do we have any new business? Okay, I will take a motion to adjourn. All in favor, say aye.
Aye.
Aye, thank you all.